Hi, I'm Kim Chrisberg. I'm a staff writer at Public Health Watch, and I lead our Uninsured in America project. So this story is about what life is like for Texans with epilepsy who don't have health insurance. And it's part of a larger project we have at Public Health Watch called Uninsured in America, where we like to tell the stories of the people that are living in America's coverage gap. What we found during this story was that Texans with epilepsy who don't have health insurance face a lot of the challenges that other uninsured Texans with chronic diseases face, which is a lack of access to care, having to ration their medications, and ending up at emergency rooms because their condition has worsened because of their lack of access to a doctor or to the medications that they need. People with epilepsy are not able to drive unless they're seizure-free for a certain amount of months in Texas. And so that inability to drive can impact employment, can impact your ability to see your friends and be social. So there are a lot of special challenges that come with epilepsy. People with epilepsy often face a lot of discrimination and stigma at work, and a lot of times are afraid to tell their employers about their condition. Linda is an uninsured Texan living with epilepsy, and her first seizure actually presented while she was driving. But before she came across these free clinics in Texas, which are somewhat unique to Texas, a lot of states don't have places where uninsured people can visit a neurologist. Before Linda found this place, she just had to sort of do what she could. She had spotty access to medication. She had spotty access to care. She did her best to control her seizures on her own, but it wasn't enough. And eventually her health condition worsened the longer she was in Texas without access to care. So Texas is unique in that there are nonprofits in our state that do run free seizure clinics for uninsured people with epilepsy who are living on low incomes. They give people an opportunity to visit with a specialist like a neurologist. They give people access to medications they can afford. So they help them as best as they can to get their seizures under control. However, these are safety net clinics. Their funding is very limited and they can't offer all treatment options. So if one of their patients, if a surgical intervention would be the most effective way that person can live as seizure-free as possible, that clinic can't afford to offer that treatment. And because that person is not insured, they likely won't be able to access it.